What do unusual prostate biopsy results mean? Imagine getting a biopsy of your prostate and hearing that the results are unusual or show some atypical cells. That can be confusing and even a little worrying, but it's important to understand what these findings really mean. When doctors analyze prostate tissue under a microscope, they look for signs of cancer or precancerous changes. Sometimes, the results show abnormalities that are not clearly cancer but aren't entirely normal either. These are called atypical or unusual findings, and they requiring careful interpretation. One common finding is called prostatic intraepithelial neoplasia, or PIN. Low-grade PIN looks very much like normal prostate tissue, so it usually doesn't increase your risk of prostate cancer. Because of that, low-grade PIN often isn't even reported in the pathology report. But high-grade PIN looks more abnormal and is considered a precancerous condition. Its presence suggests there's a higher chance of developing prostate cancer in the future. If high-grade PIN is found, especially in multiple areas of the prostate, your doctor might recommend additional tests or biopsies to keep a close eye on things. Another finding is atypical small acinar proliferation, or ASAP. This means there are some abnormal cells that look suspicious for cancer but are too few or unclear to make a definite diagnosis. Think of it as a warning sign that cancer could be present but wasn't confirmed in this biopsy. Usually, your healthcare provider will suggest a repeat biopsy in a few months to get a clearer picture. Proliferative inflammatory atrophy, or PIA, is another common result. It involves prostate cells that are smaller than usual and show signs of inflammation. PIA itself isn't cancer, but it might be a precursor that could develop into high-grade PIN or even prostate cancer over time. It's like a warning flag that your prostate tissue is undergoing some changes. There are also other less common findings, such as benign conditions like inflammation or certain benign growths that can sometimes mimic cancer. These are important because they help guide your doctor in deciding what steps to take next. It's key to remember that unusual biopsy results don't mean you definitely have cancer. They show that some cells are not normal, but they don't confirm malignancy. Because of this uncertainty, your doctor might recommend additional biopsies, imaging tests, or lab work to monitor your prostate more closely. These follow-up steps are designed to catch any developing cancer early and ensure you get the right treatment if needed. Studies show that many men with atypical biopsy results are later diagnosed with prostate cancer on subsequent testing. So, these findings are a sign that further investigation is often necessary. But it's also reassuring to know that most atypical results do not mean you have cancer right now. They are part of the process of understanding what's happening in your prostate tissue. In summary, unusual prostate biopsy results point to abnormal or precancerous changes in the tissue. They don't confirm cancer but do mean that your healthcare team needs to follow up carefully. Always discuss these findings with your doctor, who can explain what they mean for your individual health and guide you through the next steps. Remember, each person's situation is unique, and personalized medical advice is essential for the best care.